Hello, Tammy.
On this episode,
She looks as nervous as you must feel.
emotions run high as elderly Tammy faces risky surgery.
Stay strong, okay?
We need to be brave for Tammy today, don't we?
Considering life's not been easy for you, buddy.
Can Rob give little hero hope for a better future?
Whoa. But his kneecaps are going in and out of joint.
It's huge. It's grown from just a couple of weeks.
Big Bear needs urgent surgery on a worrying lump.
That's how big that is. It's just made it a bit more difficult.
You have to carry him. He can't make it across the park anymore.
And 14-year-old Waffle is struggling to walk.
His little back legs just give up.
Kate has a solution in an unlikely hiding spot.
I had this really bad feeling that they're actually up in that attic with all the spiders. Oh my goodness.
Come on, there's your girl.
You're gonna be okay, my baby doll.
At Scott's practice, Sheila is bringing in her beloved cat, Tammy.
Hello, Tammy. It's your big day today.
The Persian cat injured her leg a few weeks ago and has developed a nasty limp.
Hi there, Sheila. How are you? I'm good. Hello, Tammy. Hello, sweetheart. How are you?
Yeah, I'm going to be a brave girl today, hey?
She looks as nervous as you must feel.
I'm hiding it all for
Through a
her
beautiful
sake.
smile, that's fine. That's good. We need to be brave for Tammy today, don't we?
Tammy is my life. I cannot think of my life without her.
Shall we bring her in? Do you want to come in and see me? Yeah. Hey, come on then, gorgeous. In you come.
Tammy really had a close bond with her sister cat, and only 6 months ago she did lose her other cat, sadly. And so when it comes to consideration of any kind of medication or surgery, Sheila is going to be very worried about Tammy.
So, Sheila, how's she been over the last few days? She been all right?
Yes, she's been okay. I can see that she has got that a little bit of a limp.
I was out of the house, and when I came back in the afternoon and my daughter asked me why was Tammy limping, because she was limping continuously for 3 days. I know that there is something wrong in that leg.
Well, the unfortunate thing with this particular injury is just a lack of using it properly does mean eventually that you get loss of muscle, and then she starts walking completely differently to the way she should be.
Yeah.
All right, so let's go and check this leg first of all. Good girl. Good girl. Yes, good girl. So hips feel good. She's got good flexibility. Look at that, eh? She's got a perfectly designed face for looking at a vet. She just constantly scowling, looking really unimpressed. So she's nice and fit and healthy, but it's just this one particular leg that's the issue. The muscle wastage there is fairly significant.
You good boy. You getting ready to see Auntie Audrey? Yeah.
In Sydney, Audrey's first patient is Rottweiler Bear. Nurse Bree has just collected him from his owner.
See? Hi, Bear. Look, Bear. Look, it's Auntie Audrey. Are you wearing the masky? Hi. Oh, I'm so worried, my boy.
Audrey's known the gentle giant since he was a pup.
Bear is huge. He's probably tripled in size since the last time I saw him. It's hard to believe that he's only 18 months old.
So Dad's really worried about him?
Yeah, he's found a lump and he's quite concerned about it. Obviously, he's a young baby. He's still a bit of a puppy brain.
Yeah, where is it?
It's on his ear and it's just grown quite significantly. What was so worrying is that it's gone from bobby pin size to that in about a month.
Oh, buddy.
That looks massive and looks quite sore. So I think probably the best thing is we take him back to the hospital, shave that up, have a really good look at it, see if we test it or we take it off.
Usually we don't worry too much about lumps in a young dog. They tend not to be nasty, but with this particular lump, I am actually concerned. I'm baffled as to why it's growing so quickly, so I'm worried it could be something like a tumor. 1, 2, 3, quick. Good boy. So lumps and bumps in dogs, especially tumors or nasty tumors, can be concerning because they can spread internally, they can spread across the skin, and ultimately, if it does spread to an internal organ, it can cause death. You ready? Good boy. Just feeling his abdomen, make sure there's no lumps or bumps or anything concerning in there. All feels good, he's so big. All right, let's have a look at this ear. I'm just gonna turn him around. Turn around. I know, it's sore, I'll be gentle. So it's huge. It's grown for just a couple of weeks, but it's only on the surface. It's actually not to the underside, so that's good.
No, that's really good. But I just can't believe how quickly it's grown.
I know, buddy, it's sore. I know, buddy, it's sore.
I don't like it.
I'm concerned that it's causing him so much pain. He really doesn't like me touching it. It's hard, it's rounded, and it looks pretty sore because it's all ulcerated on the outside. Good boy. That's a funny noise.
Oh, that's weird.
Oh, that tickles. Even though Bear is a big, gentle giant, when he's in pain or when he's scared, he can start growling and potentially snap. So I'm just going really slowly with him, and hopefully he won't even notice that we're taking bloods in him today. Oh, that's the foot I need. All right, scratch yourself, it's fine. Oh my, it's on my head. Oh my God.
All right, second shower of the day, thank you.
Love our guts.
This one particular leg that's the issue. So yeah, the muscle wastage there is fairly significant.
At Scott's Veterinary Clinic, Sheila has brought in her cat Tammy after the feline mysteriously injured her rear leg.
Examining little Tammy, I found out very quickly that she's suffering with a condition known as cruciate ligament rupture. It's basically a very large ligament that runs through the center of the joint, and it basically gives stability to the knee.
It's not as common a condition actually in cats as it is in dogs.
Yes, as it is in dogs. Will the muscles build back?
Yes, so once we give the knee stability, we will then see the muscles rally and start to strengthen. But, so Sheila, has Tammy always been nervous?
I think ever since we lost our other cat, Phoenix. She's alone at home now and no one to support her.
Now I can tell that she's nervous. Anesthetics in cats are always worrying. So, you know, how is that playing on your mind?
I'm just that bit more confident that I'm leaving her in good hands.
Bless you, Sheila. Well, we'll do absolutely everything we can to make things as safe as possible, and I'll try and be as quick as possible as well.
I'll leave you in good hands, my darling. Stay strong, okay? Stay strong.
Okay, that's all. I'll look after her, I
just
promise.
feel for her because she's gone through so much. Okay?
Okay, all right.
Yes, I'm okay.
Come on, baby. All right, I know. Say bye to Mummy. This is the waving hand. Good boy.
Ciao. Thank you very much,
All right,
Scott.
you're welcome.
Yes, thank you,
Bye.
Scott.
All I want for Tammy is for her to be comfortable, to be able to get up on the sofa and not be in any way affected by this injury. Do I expect miracles and she's going to turn into a runner? No. X-ray. So what I can see, her left knee is really unstable, and so she just feels like she's on wobbly legs all the time. And that's going to make her feel more nervous and more worried. So what we need to do is to give her that stability back, get her to use that leg better. We just need to get her moving around again. This is the stifle, the knee joint. So I can feel her patella underneath my fingers here. And when I do this, it's called a cranial draw. As a result of the injury, some of the muscle bulk, the muscle mass, has withered away, basically because Tammy is not using her leg. So once we can stabilize the stifle, she'll use the leg more and hopefully the muscle should regrow.
Now it shouldn't move, but you can see it's doing that. Shouldn't do that.
In northwest Sydney, Rob is on his way to a house call to check on a very special little boy. Generous-hearted foster carer Denise has been looking after 5-year-old rescue dog Hero.
I have dedicated 30 years to rescuing and rehoming dogs. I have 4 dogs of my own and I'll foster 1 or 2 small dogs.
Brave little Hero has had a tough life.
Come on, Hero.
Born with a badly deformed front leg that made mobility a constant struggle.
Hero isn't able to go for a walk on a lead like a normal dog, so he gets put in his pram and off he goes. Not like other dogs who have functioning limbs, he's only got 1.
Having only 1 functioning front paw puts considerable strain on Hero's back legs. So Denise is hoping Rob can operate to give the little stray a better quality of life.
Hello,
Who's
Denise.
this? Hi, Rob. How are you?
Good, good, good. This is young Hero that you've told me about?
Yes.
Gosh, he's a sweetie. He's had a really tough start in his life. He's got deformed front legs, both of them. He's got a wrecked back leg. So we're going to see if we can fix him.
Isn't he sweet?
A very kind eye, hasn't he?
Yeah.
Considering life's not been easy for you, buddy.
No.
Let's have a look at him. So he's got a bit of history. He had heartworm, is that
Yes, he
correct?
did.
Let's just check him over.
Okay.
He looks healthy now, thank God.
Yes.
Hero's had heartworm and he's had treatment. His heart sounds all good. All the valves are thankfully working fine. Hopefully we'll be able to proceed with surgery. So there. Whoa.
Bad.
His patellas. Denise, I think it's both.
Oh, no.
I really do. I'm so sorry. I'll know more when I take some x-rays.
Okay.
But his kneecaps are going in and out of the joint.
Yeah.
And so it's making it very hard for him to stay stable. Normally a dog takes 80% of his weight on his front legs.
Yes.
And, well, he can't do that. He's throwing all the weight back here as much as he can.
Yep.
And that's putting so much strain on his back legs.
Poor little fellow.
You're a gorgeous little thing, aren't you?
I'm thinking that Hero is worse than we first anticipated. Bye, Hero. I'm nervous for him. You be a good boy.
Good boy. That's a funny noise.
In Sydney, huge Rottweiler Bear isn't exactly being cooperative as Audrey prepares him for surgery to check a worrying lump.
Oh, that's the foot I need. All right, scratch yourself. It's fine.
Oh,
It's on my head.
all right. Second shower of the day. Thank you.
Bear's a little bit hesitant with the sound of the clippers, so I'm trying to make it all a bit of a game.
Now there's going to be a little mozzie bite. All right, good boy. You didn't even feel it.
In the end, I don't think he even notices the needle going in, so great job to everyone. There we are.
Bear's blood results are clear. Audrey can now go ahead with his general anaesthetic
Good night, Big Bear.
so she can get a closer look at his ear.
Hey Buzz, did you want to help us lift him onto the table? He's heavy, so be careful. All right, this is going to take a lot of teamwork.
Getting Bear onto the table is a big task.
3, 2, 1.
So we've got our work cut out for us. Okay, 1, 2, 3. Okay, thanks, Buzz.
Wow, it's quite big.
Every lump is different, and I just don't know how well attached it is to the underlying structures. So I think we need to go in and remove this lump, because if we leave it any longer, we may not be able to remove it at all, or it might be something nasty. So it doesn't come through to the other side, which is good, but it certainly feels, from how it feels right now, attached to the cartilage. Like if that's the whole ear, that's how big that is. If it's attached to the cartilage, we have to remove some of the cartilage. So his ear is going to change shape slightly and it's going to bleed a lot more. Whereas if it was just attached to the skin, that would be a lot easier. Oh, that's going to be hard to close. That's just made it a bit more difficult.
Not impossible, but difficult.
Leave it. Leave it. It's definitely a paralysis tick. It's going to take a quick x-ray of your tummy and have a look what's going on in there, buddy.
In Bondi, it's a busy day at Kate's Veterinary Hospital.
You're a good boy.
She's brought in her beloved Benny.
Benny had his teeth cleaned yesterday. Oh, so clean.
And vet Edwina is about to arrive with her own elderly dog, 14-year-old pug, Waffle.
Come on.
Got Waffle when he was 8 weeks old, so I've had him in my life for 14 years. He means the world to me.
You good boy?
We've been through a lot together and he's always been there by my side.
Such a good boy. Benny, my dog, and Waffle. They're always here. Here you go, Waffle! They really are just a part of the furniture. Waffle loves to chase Benny, especially when he thinks Benny's got snacks. They both absolutely love food. And these two have the loveliest little bromance. They absolutely adore each other. Good morning. How are you?
Good, how are you?
But lately, Waffle's having increasing difficulty walking.
You have to carry him.
Yeah, I kind of have to always carry him across the park now.
He can't make it across the park anymore.
Can't make it across. I mean, he used to be able to make it across, but now his little back legs just give up. Waffle has an issue with his legs where he's got a defect in the shape of his spine. He was born like that, but over the years it's compressed on his spine and caused some damage to his spinal cord. So his back legs, they're just weak.
I don't think he has any feeling in these back legs.
No,
look at them.
Any.
Waffle doesn't feel his back legs, so he's not like he's in any pain. But what's happening now is that Waffle can't really even walk properly. So that's starting to become a mobility problem for him. I mean, to be fair, I think Benny's probably also in his category. Like, I don't think he can make it over the park either.
Oh, yeah, right.
Just old, man.
Yeah, old boys.
It's really hard to watch your dog deteriorate. And I can see in Edwina, there's this Waffle is doing really well, and then all of a sudden he's not doing well. And I know she's thinking that maybe Waffle, you know, it's almost time to say goodbye to him.
Edwina's desperately hoping there's another solution for her precious boy.
The patella is there, and the groove, I don't think it's got much of a groove at all, so it's just slopping out, it just dislocates out.
In northwest Sydney, Rob and his team are preparing for an x-ray of Hero's injured leg before they decide if the rescue dog will require major surgery.
Ready button, fire. We're happy with the hips, thank goodness. We don't have to do anything with those. The left one is just in the groove okay. I think it'll be all right. The right one, you can see there's the patella. So that's causing all the problems. That kneecap you can see is way outside. It's right on the inside of the leg. We have to try and bring it back.
Rob is satisfied with the condition of Hero's left leg and can now concentrate on correcting the serious problem on the right. Rob will now begin surgery to help improve little Hero's quality of life.
Wow. So the bone here is just totally flat across. There is no groove whatsoever. And this poor kneecap has nowhere to live. So we've got to give it a little house to start with. That's the first thing. I'll just start with this rat's tail one a bit, just get a fair bit of bite in there. Starting to get a groove, and it's hard work. Now the bone's tough. We're getting through cartilage and bone. So of course he's got a little bone that we're working with. It's not quite microsurgery, but boy, he's got little bones. At this stage, the patella's just been sitting literally inside the leg, and it's just as important in this little dog because he's got bad front legs. So we've really got to help him out.
He's a very lucky dog that he came to us. I have all the faith in the world that we'll fix his leg so that he has a better quality of life.
Look at that.
That's how big that is. Ooh, that's going to be hard to close. That's just made it a bit more difficult.
In Sydney, Audrey is shocked at just how big the lump is on Rottweiler Bear's ear. The lump has grown rapidly over the past few weeks, and Audrey's worried it could be something nasty, like a malignant tumour.
I'm just trying to see if I can get it off the cartilage, if it really is attached. While I'm removing the lump, I decided to go with the decision to remove some of his underlying cartilage. It is going to be a trickier surgery, but I think it's the right move because we need to be able to close that ear nicely, and we also need to make sure that we remove any nasty cells all in one go. But peeling it off the cartilage,
Yeah.
if it comes back nasty, we may have to go back in and get deeper margins, but for now, we try and get it all, save the ear, and if need be and it's nasty, then we've got to take off the ear. So 2 steps. Let's hope we don't have to do step 2.
Yeah.
All right, I'm taking it out.
You good? Yeah, okay.
Now that the lump is out of the ear, we pop it in a special jar and we send it off to the lab where they're going to section it and try and find out exactly what type of lump it is and how nasty it is. So I'm going to have to take out that much cartilage just to close it. Looks like we're removing some cartilage anyway. I'm really hoping that the results are going to surprise me, that it's going to come back as some weird and wonderful benign lump, so a non-nasty lump. Maybe some scar tissue, maybe a bite that's gone wrong. I'm really hoping it's not a tumour. He's such a young dog and he's got so much life left to live, so hopefully no bad news. So I'm just using a cautery tool just to stop the bleeding because the ear is really vascular, especially if you cut into cartilage. This tool just stops all of that so you can see what you're doing. Okay, so this guy is going to need lots of pain relief.
Good as new. Hey, Bear Bear.
I think the operation has gone very well, and moment of truth is to see how that ear looks now with a big chunk gone.
Wow.
Everything closes together. I'm really happy with how the wound looks. I think the ear is going to look like an ear at the end of this, and we're going to have taken every nasty cell out of his body. Fingers crossed. Once the hair grows back, you'll never even know.
Look at that. He's got bad front legs, so we've really got to help him out.
In northwest Sydney, Rob is performing knee surgery on a tough little 3-legged rescue dog, Hero.
All the muscles are orientated to pull the kneecap the wrong way, pulling it to the inside of the leg. And so we do have to actually stretch those. They're going to hurt a little bit when he wakes up, but we've got to stretch them so we get the whole thing in the right position. Just about there. It's still flicking out a bit.
It's hoped the surgery will relieve Hero's constant pain and give him better mobility.
So now we will chisel that. Okay, so we've chiseled that sharp bit of bone nearly off. And now I'm going to create the bed to push it further out where it should have been. And I've got to say, I'm going to have to move this a lot more than I usually move it. Usually talking millimetres, this is going to be centimetres almost to get this back where we want it. I'm really happy with that now. Look, that patella's staying in position. I am really pleased with that. That's good.
The final stage of the delicate operation requires inserting a metal pin to stabilise the leg.
I want it straight. That's for the one.
Hero now faces a long recovery, regular therapy and plenty of TLC.
There we go. You're waking up quick. Yeah. So I'm really happy with what we've done for him. That back leg has gone beautiful. The kneecap's sitting in the groove that we created, so it's all lined up. It's a nice line of support. Some time now and a fair bit of physio probably in the future. He'll stay here for that, and then he'll go home to his carer and we'll have a look how he goes. You're gorgeous. Look at those eyes. Aren't they gorgeous? There you go, baby. Put your head down and sleep.
You have to carry him.
Yeah.
I don't think he has any feeling in these back legs.
No.
In Bondi, Kate is trying to work out why elderly pug Waffle is losing mobility in his back legs.
Maybe we should take some x-rays of him.
Yeah, good idea. That'd be good.
Are we going to take some x-rays of your back, Waffy?
Yes.
I mean, we can do those conscious. He's good, huh?
Yeah. He's a good boy. Aren't you? You're not going anywhere fast.
Come on, let's go do it.
Do it. It is hard seeing your dog decline. I feel bad for him because I think his quality of life's just not as good as it used to be. I realise he's only got a limited amount of time left, so I just want to spend as much time with him as possible.
It's okay, buddy. Don't worry.
So what we're trying to find with the x-ray is if there has been any changes to Waffle's spine since I last took any x-ray images, which was about a year or two ago. But I just want to make sure that there's nothing else going on.
I'll press the button when you're ready.
Okay.
X-ray! What?
I know, it's bad. Yeah.
I mean, we knew it was bad, but this is like, that's like next level.
Yeah. It's quite amazing that he's still
alive. The shape of this spine is actually compressing the spinal cord. And what that means is that Waffle can't feel his back legs.
I'd love him just to live forever. But I do worry about him. I think his quality of life, just being able to get around, and he was always such an active dog when he was younger.
So for a variety of reasons, Waffle is not a surgical candidate. It's not something that we can do surgery on and all of a sudden he's going to have a fixed back. So we're going to have to find some creative ways to get Waffle to live his best life. His liver's good, his heart's good.
Yep.
I still see him as super happy. You know, every time he's here, he's such a ray of sunshine.
Yep. It's nice knowing he's not in pain, but I'd love to give him a bit more mobility.
This is the stifle, the knee joint, so I can feel her patella underneath my fingers here, and when I do this, it's called a cranial draw.
At Scott's practice,
can I get the cruciate material, please?
He is deep into surgery to repair the torn cruciate ligament on Persian cat Tammy.
Right now, I am placing a false suture, or a lateral suture, which kind of lassos the upper bone, the femur, and the lower bone, the tibia and fibula, together, and just provides tension within the stifle, the knee joint once more. So then I'm going to go underneath the patellar ligament.
I'm working quite quickly with Tammy to basically reduce the amount of anaesthetic time that she's under, and I want to make sure that we get through this anaesthetic and into her recovery.
Basically, I have to drill a hole through what's called the tibial crest, which is the second anchor point. Right, so now we've got that all into position really nicely.
It can be quite difficult to get exactly the right tension. For Tammy, all we need is for it to be secure and solid.
And same again, tension.
So it requires good communication between myself and my nurse to be able to make sure the suture is perfect for the patient.
Okay, basically that same movement that I was doing before, I can see with the placement of my suture now, I can't move the knee. As before, you could see it clonking away, now it's solid. Just what we need to get Tammy moving around a bit more comfortably again. So now I'm basically just closing Tammy up and ensure all the support structures around the outside are nice and stable, and then should be waking up. I imagine that Sheila right now is waiting by the phone, having a litter of kittens, I would say.
I think the outlook for Tammy is pretty bright. We just need her to be comfortable, to be able to get onto Sheila's lap and onto the couch, and I really feel confident that we're going to achieve that and Tammy will make the recovery that she needs to.
What a trooper you are. You have a little nana nap and I'll go call your mum. Yeah? Girl.
Hello.
Hi Sheila, it's Scott the vet. Everything is good with Tammy. The knee is now nice and solid. Everything has gone very well.
Fantastic. Thank you so much for that. You really made my day today.
Oh, Sheila, that's so kind of you to say. Really, really means a lot. Thank you, Sheila.
I'll talk to you later.
All right then, speak to you then.
Bye.
Bye. Oh, Sheila, what a dream she is.
Tammy will recover overnight at Scott's clinic to ensure there are no complications.
Good girl.
What?
I know, it's bad. Look at this.
The shape of this spine is actually compressing the spinal cord.
In Bondi, Kate is shocked at the deterioration in 14-year-old pug Waffle's spine.
You know what? A couple of months ago, there was a little pug that died and the owner had wheels and he donated them to the clinic. In amongst this place somewhere, I'm sure there's some wheels, and it was for particularly a pug. So I wonder if they'd fit him.
Let's give it a go. Funnily enough, I guess it doesn't seem a strange idea to put him in wheels for me because, you know, being a vet, it's something we do consider for our other clients.
Are you going to get some wheels?
Yes.
Yes?
Are you excited about your
I know, I have to go find them. I have this really bad feeling that they're actually up in that attic with all the spiders. Oh my goodness. See, there's going to be like snakes and spiders and everything that's going to eat me in this thing. Okay, I can see them. I found them.
Oh wow.
Yeah, they're upstairs.
Oh my God, they look perfect.
Yeah, I mean they're perfect pug size. They're a bit dusty.
Back legs.
1 and 2.
There.
Yep. Whoa. Okay. Whoa. Okay, hold on.
We know what we're doing, guys.
Take 2.
Take 2.
Okay, wait. Let's just start this again.
So far, the dream of Waffle whizzing around on wheels isn't looking too promising.
Okay, take 3. Okay, 1 leg and 2 legs. Good job, Waffy.
Down.
Good job.
That's it.
Okay, hold on. Okay, yep. Ready, Waffy? Do it! Oh my God, he loves it. So good. Can even go backwards by yourself. Waffle absolutely loves his new wheels. He thinks they're the best thing since sliced bread. Look at you! Yay!
Oh my God, it's amazing. He's taken to it like a duck to water.
Well, you're a good boy.
This is going to change Waffle's life.
Can we do a circle?
My God, it's like a pro.
It's a pro.
I might take him to the park.
It's like going to be the first time he gets to run at the park in like years.
I know. It's so nice to be able to give him the opportunity to make him feel like a puppy again. I'm a happy, happy dog mum now.
You ready? Come on. There you go. Let's go. Good boy.
It's amazing to see him running around like this again. He just looks so happy, and I think it's just so nice to be able to give him a bit more mobility and freedom.
You got it.
He's always been such an active dog, and it's just nice to see him back to his old self. Good boy.
I think that the best part of being a vet is being able to just change an animal's life, even in just a really small way. Sometimes you have to be creative, and the main purpose of being a vet is to improve that animal's life as best as you possibly can. And I think that we achieved that today.
Good boy.
At Scott's veterinary clinic, Sheila is being reunited with her beloved Tammy after the cat had surgery to repair a torn cruciate ligament.
All right, let's go see Mummy. Good girl. Hi, Sheila.
Hello.
Here's your girl.
Hello, Tammy.
Say hi.
Oh. Hello, my baby. How are you?
The surgery went really well. What we've done is place the suture,
given that niece some stability, and that will mean now she can walk, and we just need to manage those. So we'll just give her sort of things to help her with joint health, for example.
Okay.
But she's been so good, so brave, and she's done incredibly well and not complained once, have you? Has your house been quite quiet without her?
Very lonely without her.
Very
Very
lonely.
strange without her.
Yeah.
Poor girl. I missed you, baby. Eh? You've done the major part of it. Now it's up to us to take care of her.
Sheila will be the best cat nurse ever. She is so dedicated to this cat. There's nothing that I could say to Sheila regarding Tammy's recovery that she wouldn't do. And Tammy at the moment is wanting to jump up onto Sheila's bed. Sheila's already put the mattress on the floor. Maybe not so great for her, but she's put Tammy before her. I love this woman.
Okay, good girl. Okay, all right, Sheila, will you get your little princess home?
Yes.
All good. All right, well, you go and have a
Okay.
lovely evening with your girl.
Thank you very much,
All right,
Scott. Thank
you're
you
welcome.
for all your help.
You're welcome. See you later, Sheila.
Bye-bye.
Bye, Tammy.
Bye. Bye, Tammy.
Once the hair grows back, you'll never even know.
Back in Sydney, Audrey has finally managed to remove a large lump from Rottweiler Bear's ear. It will now be sent off for analysis. Audrey's hoping it's not a cancerous tumour.
Do you want it to wrap around the whole ear?
Just like that. And you pass it to me. Yep, stick it on that surface. Just keep the shape of the ear as much as you can. The operation's gone really, really well, so all we need to do now is bring him into recovery.
Are you all right, Audrey?
I am.
3.
And from there, we're going to watch him recover and pull the anaesthetic tube out once he starts swallowing.
All right, Bear, you did well. We got the lumpy out. You want to wake up and go home and see Mum and Dad?
2 hours later, it's time for Bear to be taken back home to his family.
Let's get
We're
you
very
back
sleepy.
to Daddy.
All right, come on,
Shall I
baby.
go around this way? Yeah, that's a good boy. You good? Yeah, let's do it.
Hold on, wait.
Oh, my brave boy.
Baby,
Are you okay? You ready? You want me to help?
All right.
I'm not sure
No,
I can
you're
help.
going to need my help.
Ready? Let's go, Bear.
Okay, 1, 2, 3.
Ah! Bear, you're going to have to help a little bit. Wow, I've never had this happen before.
Okay.
Bear, come on. Oh, good boy.
Oh, great. Just
Great
as I was
boy.
about to help you.
Good boy.
And sit your bottom down
Down.
there.
And relax.
Oh, my God.
And relax.
Are you going to have a sleep on the way home? Yes. That's hysterical. Good night. Let's go.
In Brisbane, Alison has received a call from a dog trainer worried about ongoing health issues with her own pet.
You're done.
Good boy.
Eddie has been part of our family for 5 years. We first noticed some health issues as a puppy. He seemed to be sick quite a lot. Chronic gut issues, diarrhea, generally feeling a bit lethargic, pretty similar symptoms to what he has now. I find it very upsetting because of the way he's feeling.
Alicia hopes Alison can work out what's causing the 5-year-old miniature dachshund's chronic problems.
Hello, Eddie.
Thanks for coming.
Thank you for having me.
Alison's arrival has lifted Eddie's spirits. Now she needs to find out why he isn't usually so energetic.
So what symptoms is Eddie displaying with those gut issues?
So diarrhea, obviously a sore tummy. He's had the blood in his poo once. When we tried to give him a little bit of duck, we had to take him to emergency because he was that sick. Just had nothing but blood coming out.
Oh, wow. So any dog that's had long-term diarrhea or softer stools, mixing a lot of different proteins can sometimes cause an issue.
It's okay.
If he ends up in hospital with that hemorrhagic diarrhea, it certainly is a sign that something very severe is going on. Is there any sort of key diets or foods that you know triggers him?
Definitely things like chicken or turkey or duck.
That really is a sign to me that he has severe allergies to certain proteins. All right, we might just do a quick physical exam on Eddie and just see what I can find.
Yeah. Eddie's pretty special to us. He's our first dog and he's our everything. We just love him to bits.
So yes, Alicia, he's definitely quite tight and tense in his abdomen. Definitely signs that there's discomfort and possibly pain.
Good boy. So we really need to find a solution so we can help Eddie have a better quality of life.
Okay, Alicia, it certainly seems like Eddie does have some food sensitivities, and particularly considering his history and what you've told me, there's certain proteins he definitely reacts really badly with, in particular duck. So I'm going to recommend that we change his diet to a functional diet like the wild boar and pumpkin, because it's a single protein. It's also a novel protein, which means that Eddie's unlikely to have had wild boar before. So we pop him on this diet trial for a couple of weeks, see how he tolerates it. We'll be able to see whether that's a food that will be great for him to continue for the rest of his life. So doing a diet trial is the best approach at this stage for Eddie. It's less invasive, we're not doing a lot of whole tests on him, and if he's tolerating it well, then essentially we'll diagnose the problem. Okay, Eddie, let's try this wild boar and pumpkin. Shall we see if you'll eat it? Oh, you like it! So this is a really good sign. He's really enjoying that, which is great. Very nice and healthy. It's got pumpkin. This will be great for his digestive health long term. We're going to fix you in no time, buddy.
So hopefully after the trial period where his guts had a chance to settle down, we'll notice him wanting to be a little bit more active and hopefully just feeling a little bit happier as well.
Good job, Eddie. You love it. I'm so pleased. You want more?
How are you?
In northwest Sydney, foster carer Denise has been reunited with Hero after surgery to repair his injured leg.
Feeling better?
It's all gone really well. I'm happy. That's nice and stable.
Yep.
Took a lot of pulling. It was all the muscles on the inside were pulling that kneecap out of the joint.
Yes.
And the thing was literally flat. There was no groove. We put it all in.
Yeah.
It's nice and stable. It's wrapped up.
So what's the next move for Hero?
He will just rest for the next 2 weeks.
Okay.
Then he may start a little bit of physiotherapy. In the meantime, I'll be carrying him out, putting him on the grass and putting him back to help him go to the toilet and just make life comfortable and something a bit different all the time. That bone will take 6 weeks to mend. Around 4-week mark, we'll start doing a little bit more physio. Once he can use that leg on his own, he can go back to his carer.
Oh, that'll be lovely. Thank you.
Pleasure.
Thank you for
All the
all
best.
you have done. Thanks, Rob. Bye. Bye, little fella. Good boy. Good boy.
At Scott's practice, it's been 2 weeks since Tammy the Persian cat had surgery on her rear leg.
Hi there, Sheila. Hi, Tammy. I'm good, thanks. Hello, gorgeous girl.
Yeah,
What's she doing?
She's looking bright.
Yeah, bright and happy.
There you go.
Well, I don't know if she ever looks happy. She looks constantly grumpy, doesn't she? All right, come on through and let's have a little look at her, shall we? Sheila is an absolute dream of an owner. She adores Tammy so much. She's been so loving to Tammy, and you can see that she's willing this cat back to good health. She's using the leg nicely though.
Come on here, darling, come. Come on, my baby,
good
come
girl.
on.
Oh, lovely
Come
walking.
Come,
That leg
come,
down
come.
really nicely. Very good.
Come. I'm really happy for her improvement because I've devoted quite a lot of time for her to get better, and she's showing the result for it. So, yes, all is good.
Well done, Tammy, and well done, Sheila. Take care. All the best, Sheila.
Thank you, Scott.
See ya. You're very welcome.
Yeah.
See ya. Bye, Tammy.
Hi, I'm Dr. Danny. If you enjoyed this video, then please remember to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content.